So good morning, everybody. My name is Christina. I'm with the SCSA. I'm an advisor. I've been here for about a year. I'm going to talk to you guys today about COVID-19 and the home building sector and residential. So we are focusing on the topic of COVID and on-site safety in residential construction. What is COVID-19? What can we do to ensure our health and safety while working during this time? What can be done if physical distancing is not plausible? What are we dealing with is the first step. As time progresses, more information becomes available and we can adjust our ways of dealing with this virus. So what is COVID-19? COVID-19 has been declared a global pandemic and a public health emergency in Saskatchewan. It is a virus that can cause respiratory illness, which can lead to hospitalization with the possibility of death. The effects of COVID-19 are expected to be much more severe than seasonal influenza because most people will not have any immunity to the virus. Seniors and people with underlying health issues, including heart disease, diabetes, and lung disease, are at a higher risk, but young and healthy people are also at risk. So, symptoms. So common symptoms include fever, tiredness, cough, shortness of breath, and breathing difficulties. Other symptoms include aches and pains, sore throat, loss of taste and smell, and on rare occasion, people will report diarrhea, nausea, or a runny nose. People with mild symptoms who are otherwise healthy should self-isolate. If symptoms feel worse than a standard cold, contact your medical provider or a COVID-19 information line such as the Health Line 811 for advice on testing and referral. With most respiratory illness, most people with COVID-19 illness will recover on their own. Currently, there is no approved vaccine that protects against COVID-19, nor is there a specific treatment yet. Also to note, there are also people that are asymptomatic, which means they are not showing any symptoms. However, as health authorities learn more about this virus, more information is coming out. Some individuals that have been diagnosed positive with COVID-19 that are asymptomatic are showing different symptoms, such as losing their sense of smell and taste. At this point, it's very important to self-monitor. Use the Sask Health self-assessment tool and keep up to date and follow the government requirements that are set out. Next is needing to know how it spreads. When it comes to your workplace, conducting a risk assessment before you start work can identify different levels of exposure to your site so you can put controls in place. But how does it spread? Right now, there are 3 known routes of transmission for COVID-19. This includes droplet, close contact, and surface contact. So breathing in droplets in the air, if somebody coughs or sneezes, they do generate droplets which are airborne for at least a short period of time, but do not float in the air and generally fall to the ground within 1 to 2 meters. Anybody who is near the individual may risk breathing in these droplets, so physical distancing, maintaining 2 meters of distance from other people at all times will reduce the risk of this occurring. Close contact refers to physical contact with another person. For example, shaking hands, hugging. When people cough or sneeze, droplets may deposit onto their skin or clothing, especially if they cough or sneeze into their hands. People who are carriers of COVID-19 may transfer the virus from their hands or clothing to other close contact. Surface contact. Surfaces can become contaminated when droplets carrying COVID-19 deposit on them or when they are touched by a person who is infected. Surface contact involves a worker touching a contaminated object and then touching their eyes, nose, or mouth. Surface contact is important to consider because while it is not yet known exactly how long COVID-19 lives on surfaces, preliminary evidence suggests it can live on objects and surfaces from a few hours to several days. This may vary under different conditions, such as the type of surface, temperature, or the humidity of the environment. It is important to know how it spreads to create a plan and procedures to conduct your work in the safest way possible. These first 2 steps are part of the process for creating an exposure control plan. If you're still working at this time, exposure plan to ensure that all areas through on how to complete a task as safe as possible. So the Occupational Health and Safety Regulations under Section 85 discusses exposure control plans and who should be involved and what content needs to be in place. Granted, with this being still new and an unknown virus, your exposure plan will have to be updated as new information becomes available. Some items the exposure plan must include, must be in writing. It must identify any workers at the place of employment who may be exposed, identify categories of the tasks and procedures that may put workers at risk of exposure, describe the ways in which an infectious material or organism can enter the body of a worker and the risks associated with that entry, and describe infection control measures to be used. To help create your exposure plan, you will need to conduct a risk assessment in order to determine workplace exposures. This process will determine the level and risk of workplace exposure to COVID-19 for your workers in each area of work. The first example is broken down into levels of exposure so you can prioritize and figure out best controls. On this next slide, here is an example of a risk assessment that can be used for a pre-job use for overall start to finish tasks to help with planning out the project timelines so that different trades can be spread out effectively as well. It can be used daily for changing conditions. When it comes to controls, the regulation requires employers to implement infectious disease controls in the following order of preference. So first choice will be engineering controls, second choice, administrative controls, and third choice will be personal protective equipment. From there, you can establish what precautions can be taken on site. Having adequate amount of wash stations or alcohol-based sanitizer readily available, avoid touching your eyes, nose, and mouth with unwashed hands or gloves. Cough and sneeze into the crease of your elbow or tissue. Do not share food, drinks, cigarettes, or personal hand tools. Make sure that hands are washed thoroughly or disinfected with hand sanitizer as soon as possible after gloves are removed. You can also implement a more frequent cleaning sanitization schedule and procedure for your safety for your site office trailers, work and personal vehicles by using a surface cleaning checklist specific to your job site. This will help alleviate any missed items, areas, and helps document and keep the cleaning schedule on track. To get into more detail for working on residential sites, there are some tips that can help everyone be safe. So figure out trades on site. Scheduling will be an asset to alleviate any worker congestion or issues with proper distancing. Timelines for different installations should be analyzed and broken down to allocate workers to specific housing structures, lengthen completion times due to reduction of workers, delivery schedules, hoisting operations, working at heights operations. Having a planned out schedule for when jobs need to be done by will be crucial to your success on keeping the workers safe with the proper distancing and timing. As well, communication is crucial on this part. You can also know the total number of people on site and where they are assigned to work. Have start times, breaks, lunches staggered to help avoid close contact. Generally, residential sites do not have access to lunch rooms or job trailers, so ensure workers are taking breaks in isolated areas or in their own vehicles. Also have workers come to work in their own vehicles as well. Ensure 2-meter distancing. Meetings outside and spaced out 6 feet between personnel, or if you can use video phone systems for meetings, then do so. Any deliveries to site, you can either have the driver remain in their cab and unload the items for them, or the delivery driver can unload the items at a specific location so there is no close proximities breached. Visitors to site, such as inspectors, have them walk around and complete inspections on their own. Once done, they can go over the findings over phone call, video chat in a separate vehicle or through proper distancing. The signatures are needed. You can come up with a procedure where documents can be signed electronically to avoid surface exposure. When dealing with homeowners, whether it's warranty work, renovations, or general fixing and installations, See if it can be held off if it's not crucial to be completed right away. If you do need to conduct work at an occupied residential location, conduct a thorough phone call questionnaire before scheduling, determining the hazards and exposures prior to accessing the site, verification of health of homeowners, where they will be during the work completion, a PPE and hand sanitizer readily available, detailed cleanup procedures, payment and processing procedures as well. Ensure that work clothes are being washed, cleaned daily, or are isolated until they can be washed, and have clean work clothes daily to avoid spreading to other residential sites. You do health verifications, use the Government of Saskatchewan COVID-19 self-assessment tool questions to verify that workers and visitors are not feeling sick, and so they are aware of what the symptoms are so they can self-monitor. You can also request that any visitors to call and schedule in advance for a specific time before showing up to any site. You can limit the number of persons in orientations. You can utilize video orientations when possible. As part of the verbal orientation, you can discuss physical distancing of 2 meters, hygiene and location of hand washing and hand sanitizing locations, what the company is doing at that site, promote health and safety of the workplace, and remind them that their health and everyone's health is important. The importance of reporting to the supervisors if you are not feeling unwell and are leaving sites. You can limit the number of workers or restrict who is allowed to enter office trailers or enclosed tool trailers. You can place contact information, phone numbers outside on the doors. You can avoid sharing tools or equipment. If you have to share equipment, clean and disinfect points of contact on the equipment. For final finishing stages and handover stage, you avoid touching surfaces you do not need to. You can wear gloves and respirators, disposable boot covers, wear clean work clothes or disposable coveralls when entering a new site at finishing stages to avoid contact surface spreading, and then disinfect work area once completed. So there may be times when physical distancing is not possible. There are added measures that can be done in those types of situations. So plan job tasks to limit the amount of time workers need to be closer together than 6 feet. Develop a safe job procedure for tasks that require workers to be closer together than 6 feet. When workers need to work in close proximity to each other, they should wear appropriate PPE, such as gloves, safety glasses, fitted N95 respirator or P100 respirator, and disposable coveralls or clean clothes. The workers need to distance themselves from their coworkers if they do need to sneeze or cough. This should be done into their elbow or tissue. Tissue should be disposed of immediately into proper waste receptacles. The worker will need to thoroughly wash or sanitize their hands prior to resuming work. When the task is complete, employees should thoroughly wash or sanitize their hands, and then disposable PPE such as gloves, Tyvek coveralls, and disposable respirators should be disposed of properly in a waste receptacle. Any reusable items such as safety glasses, hard hats should be thoroughly washed. Lastly, keep yourself updated on new information regarding COVID-19. The more we know, the more we can put the best controls in place to prevent. Okay, so well, that wraps up the presentation. Make sure to check out our website for up-to-date information regarding COVID-19, as well as for information that was discussed today. The SCSA team has been working hard on creating useful documentation, as well as having links and resources readily available for you to help and navigate during this difficult time. If you do need to contact an advisor with any questions or concerns, our emails are listed on our website under our contact tab and listed in the Regina and Saskatoon office locations. And that wraps it up. Thank you.